Good afternoon. I will be talking on exploring novel artificial intelligence derived dry eye analyzer in clinical practice. Financial disclosure none, conflict of interest none. Artificial intelligence has taken its grasp over the healthcare system, and ophthalmology, as one of the most dynamic stream, is largely influenced by AI and AI derived software. There has been few encouraging reports of AI-derived algorithm in the diagnosis of dry eye in the current literature. The deeper forms of AI machine learning is utilized for the interpretation of NIBUT and interferometry, whereas deep learning is used for doing mammography imaging. When we consider the market of dry eye, it is hoarded with these imaging devices, and it is often not possible for a standalone ophthalmologist to acquire all of this. This is where the multi-imaging integrated device comes into play. Our purpose is to explore the diagnostic potential of novel AI-derived dry eye analyzer in clinical practice of dry eye disease. Methodology is a prospective, comparative, non-interventional study in 520 subjects. Ethics committee approval was obtained. For patients presenting with signs and symptoms of dry eye, first the Ocular Surface Disease Index questionnaire was done, then followed by dry eye analyzer. The traditional test of Schirmer and ocular staining were also done. We all know it is pertinent to sufficiently distinguish between the aqueous deficient and the lipid deficient or the evaporative kind of dry eye so that we can go in for a targeted therapy. So what does this AI device does? It measures the non-invasive breakup time, the tear meniscus height, the infrared mammography, and lipid layer interferometry. Non-invasive breakup time is based on the principle of projection of Placido's disc with white light onto the cornea, and it looks for image distortion. It gives the first rupture time, the average rupture time, and a breakup distribution. It generates a heat map seen right to the video of each of the picture. Tear meniscus height is measured with an inbuilt ruler in line with the pupillary center, and the above two figures here have normal TMH, which is 0.2 and 0.3 in this case, and you will note that they have normal tear meniscus volume. Compare this to these two figures below, and they have abnormal TMH of 0.12 and 0.14, and you will also note that their TMH or tear meniscus volume is lesser than the two figures in the top. Infrared mammography is based on the principle of autofluorescence of healthy mabum when an infrared light falls into it and it is captured by a coupled camera. So the first image is what you see here, and then the AI image is superimposed on it, and then we get an idea of the gland loss and the gland dropout. The first figure is a grade 1 MGD, the one in the middle is a grade 2 MGD with 45% gland loss, and the one in the right is grade 3 MGD with 78% gland loss. Coming to lipid layer interferometry, it is based on the principle that when adequate light hits an oily layer, there is colorful fringes that is generated. Now compare the two videos in the top where you will see that there are too much interference fringes versus the two videos below, which has relatively colorless picture because their lipid layer is less than normal. Our results show 51% positivity in Schirmer, 38% in corneal staining, lipid layer abnormality was found in 52%, MGD was found in 56%. We have also done a correlation between the various tests, and the one in the green or the positive values show normal report. So among all the patients coming to us with signs and symptoms of dry eye, 77% were having actually dry eye. This is the overall positivity report in all the tests. 8.6% has positive results in all the parameters. In discussion, what we already know about this device is that it is automated, non-invasive, independent of clinician judgment, it is quick, and it makes the monitoring easier. What our study adds? That meibomian gland disease and abnormal lipid layer thickness contributes to more than 52% of cases. Cases hitherto missed by conventional test in our study 14% could be diagnosed by this AI device. Dry eye analyzer, when used in conjunction with traditional test, is complementary. There are certain limitations of our study. There is a lack of standardized image format and analysis model. Monitoring patient scores over a treatment of time was not done. What is the translational potential of this study? This is the printout that is generated at the end of the study, and this color-coded report can be utilized to raise the patient's awareness and thus increase compliance. We can go in for image-based targeted therapy. Precise monitoring of treatment response can be done. What is the future perspective of this study? This kind of AI software can be utilized or incorporated in the smartphone and can be used for mass screening in a setup outside the clinic. Thank you very much for your kind attention.
Thank you so much for a very, very nice presentation. I just wanted to know where have you got this artificial intelligence from? Is it in the form of a device? And is that device, let's say, validated? I just would like to know about that.
Yeah, this is a device that we got in one of the AIOC conferences. We acquired this machine. It is called Dry Eye Analyzer, and it is based on AI.
So do you think that this is basically the normative data which is present in the machine that you all have tried to utilize in order to do your tests?
The normative data is there in the machine, and it follows a particular pattern because there are certain other multi-imaging integrated devices also, like the Oculus, and those are also validated.
Right. Thank you. Anything?
I just have a question. There is a standardized image format for this, what you have used in this device?
Yes, there is some, which also is in comparison with the other multi-imaging device.
Already that is existing.
Yes. Thank you very much.